I would say that almost every patient who's in the hospital is on some sort of medication, whether it just be a Tylenol or whether it be a whole slew of medications. So I think it's really important that we do our job accurately and that we're safe so that we can help give our patients the best outcome.
So what we do, instead of keeping it kind of in that form, we cut it into sheets of 10 tablets.
What we're doing is we're kind of looking at our patients on our units, and then we're kind of evaluating if further interventions need to be made. Because I'm dealing with the doctors directly and the nurses, we could discuss issues more directly. So we're actually actively involved in medications that the patients are on.
The generic name strength, manufacturer lot, and so that's the requirement. Each pocket of drug has to have that. Especially when you work in a hospital, like an institutional setting, there's a lot of different pieces of the puzzle. Making sure it's the right drug, right strength, integrity of the drug, making sure it's not expired or chipped, or, if it's injectable, making sure everything is sealed, and right quantities dispensed, and if there's any other auxiliary labels or expiry dates that we need to add, make sure I'm checking for those as well.
So we'll just have to follow up on that, I guess.
So we're monitoring for patients' adverse effects. The goal is basically providing the maximum amount of clinical benefit with the minimal amount of adverse effects. So we go in and we educate the patients about their medications as well. So we'll teach them about how their medications work, if there's any changes, what's the importance of those medications, and why they need to be on these things.
A machine needs vancomycin 125, so we are ensuring that patients are getting the correct drug at right time, right dose.
Without our expertise, they wouldn't get their meds in reality. I mean, you need an entire team to be able to do every part of pharmacy.
So then once I scan, it's only going to open that pocket.
So there's a lot of work that goes on in the background to make sure that patients at all sites have those medications. Whether you're a physician, a surgeon, a diet aide, a housekeeper, a unit assistant, everybody has a really important role in taking care of our patients. And if one role isn't there, the work doesn't happen.
Take a lot of pride in our team here. You can always count on each other's support, and we all work together to ensure that our residents here get the best care possible.
We all work as a team here, and we all really enjoy one another.
It's like a family away from your family.
They're really independent. They always have patient safety first. So everything that they do is with a patient safety focus lens, always. I just like the fact that I can kind of give back to the system that has, taken care of me.
It's completed and signed and it's accurate. You're ensuring somebody gets their medication and they'll feel better and they'll get better. Trying to give them the best care possible.